Hi, my name is Gina Reynolds, and I just had a minimally invasive total knee replacement with Dr. Berger, and he's out of Rush, Midwest Orthopedics, and he has been fabulous. I tried to find a doctor here to do a total knee replacement. I had had meniscus surgery 7 years ago that really was a failure. 5 weeks after they said I needed partial knee, I said, no, you told me this would fix it. So I've lived with it, but it was just getting worse and worse, and to the point where I'm a professor and I lecturing in front of class was having trouble. My knee would give out and then I would be on painkillers for several days. I couldn't walk my grandkids around the block, push in the stroller, that kind of thing. And I'm just too young to want to sit in a rocking chair. So I just needed to have something done. So this summer I looked into it. I went to a traditional surgeon here in South Bend and they wanted to do like the regular 10-inch incision traditional surgery. And I was really considering that, but I just didn't feel at peace with it. So I started researching, found this minimally invasive. Closest one to me I could find was Rush, and I got put in touch with Dr. Berger, and that's who I went to see. Rush is about an hour and 45 minutes from here, depending on traffic, and I ended up having it at a surgery center that he goes to in Charleston, Indiana, which is about an hour from Niles, Michigan, where I live. So it was very doable. I wasn't sure if that was possible, with blood clots riding in the car, but actually 20% of his patients, he said, actually come from elsewhere, from other states beside Illinois. So it's very doable. So at any rate, I went in at 7:30 and was home by 12:15. It was fantastic. I have a lot of trouble with anesthesia. And so I get really sick and nauseous, and it makes me very anxious. And so I talked to him about not doing the twilight type anesthesia and just doing the spinal. And I was so impressed when I was at his office. They called me back the next day and said they talked to the anesthesiologist, and yes, that would be a possibility. And that is, in fact, what I did, and it was fabulous. If you have some of those issues, I highly encourage you to find a doctor that'll do it. It was so much better for me. Right, coming out of that, I was just waiting for my legs to wake up and I was able to walk. I wasn't sick. It was just an amazing experience. I had an amazing experience talking with the anesthesiologist the whole time. He was saying, where do you think your leg is now? What do you think's going on? It was fantastic. I would do it again in a heartbeat. So that was great. Came home, I was doing great. I walked right out of there, which is what he said I would do. Everybody else's question, yeah, maybe you will. No, I did. I had no problem at all. I was a little wobbly. It felt just a little wobbly kind of on my knee, but I was able to go up their stairs, even like the one at a time up the stairs before I left, which they were kind of like, oh, whoa, whoa, whoa. But I felt almost normal walking, a little slower, just a little uneasy, but really pretty much almost normal. So went home. I had a really great first week. I walked, which I'll show you a picture of if I can get it to work in a minute. I walked down my driveway, which is quite a length, on day 3. And then day 5, I went just a little bit farther out into the neighborhood, walking pretty normally, just a little slower. But it felt pretty normal, felt good, and everything's going really well. So I had a hard time finding minimally invasive total knee replacement stories, pictures, things like that. So that's why I'm doing this. So I am going to flip over and show you some pictures of my actual scar. So if you don't want to see that, you might want to stop this now. But I want to show you what it actually looked like. Um, and I think that, let's see if you can see this. Um, this because I'm a professor, the easiest way for me to do this is kind of like a slideshow. So hopefully you will be able to see this. On day 1 is on the left and day 10 is on the right. Um, I don't see a whole lot of difference, but day 1 is the first day home. So not the surgery day, but the first full day is what they call day 1. And I did measure the scar. Mine is actually about 4.5 to 4 3/4 inches. So it is on the small side, which is fabulous. I don't see a ton of difference in the pictures. I did reduce swelling about an inch, probably around day 8 or day 9. I came down, it seemed like about an inch or so. I did have a little blip where I had to go off of the NSAID because of some digestive issues. And so that may have contributed to some less swelling, more swelling, that kind of thing. On the picture on the right, you'll see I do have some bruising, but I didn't have horrible bruising, especially on the front side. I did have some pretty bad bruising on the back of my thigh, like almost towards my butt cheek. But other than that, I didn't have a ton of bruising. The next slide, if I can get this to work, this shows me actually walking. And I'm not sure if it will pick up on the recording or not, but this was on day 7. This is just walking down my driveway. You can say I can walk frontwards and backwards without any problem. It felt really good. So right after that, I will say that I did have somewhat of a setback. I had physical therapy actually that same day that I did that. And at the physical therapy, we did some exercises, um, particularly doing some hamstring stretches, and it really overstretched it. Didn't know that was possible, but it hurt like crazy the next day. So Saturday and Sunday, I was really limping, in a lot of pain, and really had a setback. So that was really unfortunate. Um, so the only thing I can say too is they say overdo it, but I wasn't even really overdoing it. And the walking and stuff had felt good, but just some of the different exercises, the repetitive exercises, I was really only a week out, and I was doing so well. So the physical therapists are like, oh, yeah, we'll do this and do this. And I could do it, but I think the tissue was just not healed enough for that. So, in retrospect, I can't emphasize enough. Just don't do a lot of physical therapy. I have a home physical therapist coming, but just really stick with really gentle. Even if you're moving and doing stuff, I don't do those, squats. And for me, it was like a hamstring stretch that I think was really the worst thing, is doing some of that hamstring stuff. It set me back, and I'm now at about 11 or 12 days out. And it's taken me 4 or 5 days, and I think tomorrow or the next day I might be back where I was, which was really disappointing to me because I was doing so well. So just keep that in mind. The other thing I will say that I didn't read about or hear about was some digestive issues. And my doctor recommended going on Senecot because you're going to be on hydrocodone, and that can constipate you. I've never had a problem with that in my life. I've never been on a laxative or anything in my life, but I went along with the protocol. Unfortunately, I did not do well with it. I had incredible cramping 2 different days. So much so that it felt like I was birthing a child, and I've birthed a couple of them naturally, so I do know what that feels like. And it was like that. It was horrible, horrible cramping pain. And so I will not take Senecot ever again. And they took me off of my NSAID and my antibiotic, trying to figure out what this was. So I'm only on NSAID, and I am taking hydrocodone occasionally. Hydrocodone also has a reputation for doing that, but I'd been on hydrocodone before. Even the week before my surgery, I kind of hurt my knee just walking in front of my classroom teaching. And so for 3 days, I was taking it. I've taken it off and on for pain like that, and it's never given me stomach issues. So I think it's really the aspirin that is giving me stomach issues. I'm on high dose aspirin for blood clots. And I'm getting through it, and it's better now that I'm not taking that laxative, but that just was really not a good thing for me. So that's just something to consider. So anyway, I hope this has kind of helped you. I'm doing great. You can see, I can bend it. I have my lovely tights on that will just be your friend. I can bend, I can straighten, I can walk. It's just been fabulous. I just don't walk quite as quickly, but I really do expect, he said in 3 weeks I'll be at 90%, and I think that I probably will. Maybe even at 2 weeks I might be there. So very happy with it. I'm happy to make another one of these with more progress, more updates if anybody's interested. I am not really a YouTuber, so I don't know if anybody will watch this, but I wanted to put it out there in case somebody like me was looking for information. So I hope it helps. Good luck in your journey.